At the outset, I'd have to say that this is not a service plan that we would welcome. Clearly, it's a blueprint for further significant cuts in our health services over the course of 2014. And in fact, that has already had an application in the last quarter of 2013, since the budget announcement back in October that there would be some 666 million of cuts in the coming year. The reality is that with the reduction to 619 million, that this government is attempting to make a spin that in some way it's not as bad as was originally indicated. That is absolutely unacceptable. 619 million is no more acceptable than 666. The reality is that our health services cannot sustain these cuts. What are we looking at? We're looking at huge cuts in relation to primary care, 294 million. We're looking at the cuts in terms of acute hospitals. There are 48 public hospital sites across this state. They're carrying forward the same cuts that were applied last year into the current year and adding to it. The reality is that there will be cuts to these acute hospital sites of some 74 million in this year as against the 2012 figure. And when you look at medical cards, are we expected to be in some way relieved that the signalled 113 million is not now to proceed in relation to probity and that it's only going to be 23 million? When we do the calculation in relation to this and based on the approach of the Director General of the HSE, that equates with something of the order of 112 to 115,000 cards in 2014. Those people are already losing their cards since October. It's continuing day in and day out and will continue throughout 2014. Many of those people, if not all of them, are entitled to the cards based on the assessment that granted them in the first place. And they are facing untold hardship, as we have recounted today and on previous days in relation to specific cases that have been brought to my attention as Sinn Féin Health spokesperson and to the attention of my colleagues across all constituencies. We reject outright this so-called service plan, recognising it to be what it is, a blueprint for further serious and untenable cuts across our health services.